Yes, thank you very much, Mary, and thank you for the opportunity to be here today with you and among these distinguished panelists. So I'm a health economist working at IHE, the Swedish Institute for Health Economics, and together with Professor Niels Wilking and Professor Peter Lindgren, we have just published a report called Diagnosed but Not Treated: How to Improve Patient Access to Advanced Non-Small Cell Lung Cancer Treatment in Europe. And we analyzed 12 countries in this study. Greece was one of the countries that we analyzed. You've already heard some background about lung cancer. It's the leading cause of cancer death in Europe and also in Greece. The prognosis of lung cancer patients is unfortunately really poor. You've seen the survival rates ranging between 10 and 20% in Europe. But the good news is that there have been many new treatment options that have become available during the past 10 years. The question is, of course, have patients gained access to those new treatments? And that was the background to our study, where we actually tried to answer a more fundamental question: how many patients with advanced non-small cell lung cancer are getting drug treatment, because drug treatment is the recommended treatment option in this patient group. And then we also qualitatively tried to answer why are many patients not being treated with cancer drugs, and why do those that do receive treatment seem to receive outdated treatment options. And here we relied on local expertise, amongst others Dr. Saridaki, and also input from Fairlife Lung Cancer Group that you heard speak in the morning. So looking at the results for Greece, we have looked at what we call the drug treatment rates in advanced non-small cell lung cancer between the years 2014 and 2020. And you see that in the beginning, 2014 to 2016, the drug treatment rate was about 60%, meaning that the remaining 40% did not receive cancer drug treatment. This situation improved a little bit. In 2018 to 2020, we estimate that around 70% of these patients received treatment. But what's interesting is to compare the Greek results to what we call a benchmark of optimal treatment, which we derived from ESMO, the European Society for Medical Oncology treatment guidelines that they publish regularly for the treatment of patients with advanced non-small cell lung cancer. And you see here, looking at the benchmark, that the overall treatment rate is recommended to be at around 75%, and this has not changed between 2014 and 2020. But what has changed during this period is the kind of treatment that patients should receive, moving away from chemotherapy, the red part, to using instead immunotherapy, the yellow part, and targeted therapy, the blue part. And without having access to these newer treatment options, immunotherapy, targeted therapy, it is difficult to improve the outcomes for lung cancer patients. What we also did is to compare now Greece to the other countries in Europe, so to the other 11 countries that we had in our study. And perhaps surprising to people from outside of Greece, Greece actually ended up in the top group in our study, together with Belgium, Norway, Portugal. Norway and Portugal are possibly a little bit ahead of Greece, but still Greece is actually in the top group. At the bottom we have Poland and Great Britain. And what we also saw, that even in the highest performing countries, so let's say Norway and Portugal, we see, similar to Greece, an underuse of immunotherapy and targeted therapy. So this has been a challenge to implement those new, or bring these new treatment options into clinical practice. Now looking at the qualitative part of our study, we came up with 4 main explanations of why patients remain untreated. The first one is that they already have a poor health status at the time of diagnosis, so they're too sick to get treated, unfortunately, which explains why the ESMO benchmark, the optimal benchmark, is not 100% treatment rate, but actually just 75%. The second challenge are delays in time from diagnosis to to treatment. Lung cancer progresses really quickly, so it's very, very important to have timely access to treatment, but we see delays, not just weeks, but often months for lung cancer patients. The third one are narrow eligibility criteria for who is to receive drug treatment, and the fourth one is treatment refusal by patients. There are also four main explanations for why patients might receive outdated treatment options. One is that there are delays in local reimbursement of drugs that have been approved by the European Medicines Agency. The second one is limited public drug budgets. The third one are limited resources for testing, because all the new modern cancer drugs require prior testing. So you need to pay for testing, you need to have the staff to do the testing. And the fourth and final explanation is limited continuing medical education, which might not be a problem among clinical staff that is treating patients at university hospitals. But if you look at smaller hospitals in rural areas, this is a challenge. So I'll stop now with my presentation. In the report, we're also providing solutions to overcome these barriers, and I'm very happy to talk both about the results, the barriers, and the solutions with the fellow panelists.
Thank you very much.